Good morning. I plan on being with you today, and I'm sorry that I was unable to attend. My name's Virginia Krieger. I lost my only daughter, Tiffany, in 2015 to a counterfeit pill that was pure fentanyl. Tiffany was a beautiful, bright young woman who had a great future in front of her. She injured her back and she did what every other person would do in that situation. She went to the emergency room. She went to see her physician. She got the referral to the neurosurgeon. And in between that time, while she was waiting for that neurosurgeon appointment, an acquaintance whom she trusted offered her what looked to be a Percocet to help with her pain. It wasn't a Percocet, it was fentanyl, and it killed her. After Tiffany's loss, my youngest son fell into such great despair that he began abusing methamphetamines, and he has almost died 3 times from fentanyl and meth. My youngest son is currently fighting for his life in a hospital in Fort Lauderdale, Florida. My grandchildren are growing up without their mother. My son may not survive his injuries. And all of this came from one pill, which went through my family like a freight train and destroyed it forever. In the United States, more than 158 million people last year admitted on a drug survey to using an off-market pill or trying a drug at least once within that year. So a problem that would have been limited to the traditional substance use disorder community has now expanded to include the general public. Yet the public remains largely unaware and uneducated as to what this fentanyl crisis really is. Illicit fentanyl is made in China. It is a synthetic opiate, and in fact is modified to make it even stronger than the prescription grade fentanyl, which we make here in the United States. It's not the same as a prescription product. In fact, it's far more dangerous. In 2021 alone, we lost 71,248 lives to illicit fentanyl poisonings. These people came from every walk of life. They were every race, every financial background. So the greatest risk to our children today comes every Friday night when they might leave the house and be influenced by their friends to try or use an off-market pill or to try a drug. They have found it in pills which are mimicking Xanax, Adderall, Vicodin, Percocet, oxycodone, OxyContin. They found it in meth. They found it in heroin. They found it in cocaine, even ecstasy, fake Adderalls, which are commonly used on college campuses, which college students use to stay awake for exams, are even being mimicked. So the greatest danger to our society today, the greatest national security threat we face, is coming directly from China in collaboration with Mexico's drug cartels. Our organization, Lost Voices of Fentanyl, is comprised of more than 26,000 bereaved family members nationwide who have lost their loved ones to illicit fentanyl poisonings. We're demanding action by our government. We want public safety warnings to be put out. We want public education so that people are aware of the dangers that their loved ones face with illicit fentanyl. We're asking for fentanyl to be named a weapon of mass destruction so that we can free up federal resources to go after the purveyors of these deadly products. But we need help. We can't do it alone. More than 71,248 Americans died in 2021 alone from illicit fentanyl poisonings. That's more lives lost than the 20-year Vietnam War. And we aren't even on the battlefield. We're not fighting to save our kids, and we need to. If anyone had told me that this would be what I'm doing now, I would never have believed it. 2 of my 3 children have been impacted by this. And my family will never come back. But I can fight to make sure that your families are safe. And that's our fight. We pray every day that we will get the support we need, that we will have others join us in this fight to protect our children. During COVID, within 30 days, everyone knew 3 things: social distance, wear a mask, wash your hands. We are 10 years into this crisis, and most of the public doesn't even know that these fake pills exist, that this isn't prescription fentanyl, and they don't know that they're at risk. And that has to change. The number to measure the size and scope of this crisis is not going to be found in just the number of deaths. The true measurement of this crisis will be found in how many injuries there are every day in survivors combined with the deaths. But to date, that data is not even being collected. So the federal government has claimed that they're responding to this, yet they haven't even assessed the size and scope of the problem. So how could they possibly respond to a problem they haven't assessed? We're asking them to start tracking the number of fentanyl-related injuries every day. We're asking them to address China and the cartels, and for us to get on the battlefield to save our children's lives. I want to thank everyone who came today to show your support, to stand up and fight for our children. Because if we don't do it, nobody will. So thank you so much for coming. And please visit us, our Facebook discussion group, Lost Voices of Fentanyl. And you can also find our website at lvof.org. This is the fight of our lives. And we need everybody on the battlefield. Thank you.